I'd like to welcome you today to the Gold Coast Plastic Surgery Podcast. I'm Dr. Mark Doyle. I'm a specialist plastic surgeon and I've been doing this for the last 30 plus years. Today we're going to be talking about nasal surgery and I'm pleased to be able to introduce to you Dr. Stephen Kleid, a nose and throat surgeon. Between us we should cover everything you need to know about nasal surgery. Because we're talking about rhinoplasty and all things noses, a topic that comes up really regularly is, do you use a splint and do you use a pack? And it'll be interesting to see what I do and what Stephen does and see if we're on the same page or not. So that the packing of the nose is something that was designed to keep septums and things like that in place when you've altered the shape of the septum. Packs can be used to prevent bleeding from the nose straight after the operation whilst everything is healing. The problem I have with the packs, and the reason I never use them, and the reason my boss, when I was doing this many, many years ago, said to me, if you use packs, people remember that for the rest of their lives. And the reason for that is the packs can be up to 2 meters long. They get pushed up the inside of the nose, which means there's compression throughout the nose, which means nothing can bleed. So that's a good idea. The problem with it is that when the pack comes out, it is really painful. It's something that people will remember forever. And when it comes out, it can cause bleeding. So rather than having an operation, doing the procedure, there's a little bit of bleeding and you fix it at the time without a pack, problem solved. If you go the other way and use a pack, then you've always got the problem down the track. When you see the patients, you pull the pack out, starts to bleed, they get anxious, the blood pressure goes up, they bleed a bit more. It's just something that all the time I've been doing rhinoplasties, I've never used a pack. What's your side of it? Stephen, are you coming from an ENT rather than a plastics? What do you do?
Well, I'm operating on noses and inside of noses and sinuses and rhinoplasty. I never use packs. About 25 years ago, I gave a talk to the ENT Society annual conference on my first 5 years of practice of not putting in packs. Taught people how to suture up the septum and stabilise it much more effectively without putting in a pack. And because the pack stays in for 1, 2 or 3 days. In fact, when my mum had her very bad rhinoplasty back in the 60s, she had a pack in her nose for a week. But I don't use packs, I use dissolving sutures. I never use splints. Some people use little plastic splints, soft plastic splints that sit on either side of the septum to stabilise the nose. Supposedly, the technique that I use, I don't need to use, I almost never need to use splints. So in a 12-month period, I might put in 1 splint and 1 pack, and other than that, it's not needed. Also nowadays, if I do have to put on that once a year when I do put in a pack, I don't put in 2 meters. That's 2 meters, that's this far. 2 meters of ribbon gauze on each side. That's how I was taught to do it. I can do it. It's in there pretty tightly and it's pretty awful having it out, and patients feel like you're pulling out their brains when you pull it out, and then it bleeds again. So if I do that, I now use a softer sponge, which is more comfortable, but I almost never use it.
Okay. And when you're talking about splints, there's 2 sorts of splints, isn't it? There's a splint inside the nose that's helping keep the septum straight, for example, and there's a splint that goes on the outside. Now, do you use the ones on the outside?
Oh yeah, sorry, I'd call that a cast more than a splint. Okay. I think it's a confusing terminology. I think of that as a cast, and for that we used to use plaster of Paris cast, same as you put on a fractured arm, but now I use an adhesive heat molded plastic. So you just soak it in boiling water and then mold it put on tapes on the skin that it will adhere to, so the tape sticks to the skin and the plastic sticks to the tape, and that stays on for a week. That's a cast, and that just stabilises or protects the nose from being bumped in the first week. It comes off after about day 7. Yeah,
well, I do exactly the same. External splints always, but for rhinoplasties, but internal virtually never. I'd like to thank you for visiting our podcast today. It was a pleasure to introduce Stephen Kleid, our ENT surgeon, and I hope you've gained some valuable information regarding nasal surgery in general.
Thank you very much. Thank you, Mark. Thank you.